TeethXpress refers to a procedure that replaces either all the teeth on one or both jaws in a patient in a well-planned and coordinated manner. Candidates for TeethXpress are patients that have either no teeth left, they've been wearing dentures for many years, or they have severe periodontal disease where periodontal treatment is no longer effective in maintaining the bone in their jaws. This process requires first a sound plan. So the first thing we do at an initial visit is to determine the patient's history and then complete a workup involving imaging via a 3D scanner, an intraoral scanner, and some impressions. And then the following visit, the patient is ready for their surgical treatment. But a plan is put into place well before that visit for surgery. Once that plan is coordinated with the lab and a restorative dentist, we sit down and do the surgery. The surgery is rather straightforward. The surgery involves placing 4 to 6 implants per jaw, and then depending on the density of bone, we either can place temporary dentures, fixed dentures, on the lower jaw and occasionally on the upper jaw, primarily on the lower jaw. This procedure takes about 4 to 5 hours if it's upper and lower jaw, about 2 or 3 hours if it's just one jaw, and the patient can expect 3 or 4 days of soreness and swelling thereafter. Once the bone density has been analyzed at the time of surgery, we can determine when the patient will get a set of final fixed teeth because we have to allow gum tissue to heal properly. This process usually takes about 4 to 5 months total, depending on each individual patient's needs. Once the TeethXpress procedure is complete, you can expect to chew anything you want. You can speak effectively. You can kiss anybody you want to. The teeth will not fall out or fly out or anything like that. It will impart a high level of self-confidence and self-esteem. And probably most importantly, it will help with overall health because now you can chew food a lot better.